Hello. I have some questions I'd like you to think about as we start this podcast today. Have you noticed yourself feeling empty inside, hopeless, sad, irritable? Have absolutely lost interest in things you've once found enjoyable? Lost weight without trying? Gained more than 5 or 10 pounds within the last couple of months? Notice you're eating more, perhaps eating less than normal? Having difficulty falling asleep? Or just the opposite? Staying up all the time? Feeling drained? Feeling really tired? Have you found yourself napping more than you normally would? Have you found yourself having thoughts of harming yourself? If you were able to identify with some of the symptoms that I just mentioned, you may be suffering from depression. And I would encourage you to undergo an evaluation by a licensed mental health provider. This podcast is for informational purposes and not intended to provide a clinical diagnosis, but to provide education and some treatment options to help with elevating your mood. I strongly believe depression is one of the disorders that has a potential to land at everyone's doorstep at some point in life, based on life circumstances, financial issues, health issues, relationship issues, conflicts at work, unexpected vehicle or home repairs, lack of financial resources, death of a loved one, working hard for a promotion just to find out you didn't get the job, breaking off an engagement, getting a divorce, falling out with a lifelong friend, a sports injury that ended your season, perhaps even ended your career. There's a plethora of scenarios that can land someone in a state of depression. The goal is to dig into your toolbox and select a tool to help dig yourself out. So let's talk about depression. Depression can be attributed to a decreased level in serotonin in the brain. So what's serotonin? Serotonin is a neurotransmitter. The body have a lot of neurotransmitters. I'm going to hone in on serotonin today. So a transmitter is a chemical messenger. It carries messages from one nerve to another nerve, or from one nerve to a gland, to a cell. And it tells our body how to react. It tells our bodies when to move your legs, when to move your arms. It tells our heart when to beat. It tells us when we're thirsty, when we're hungry. Even tells our brain how to feel. So let's discuss some options to raise your serotonin levels naturally, or to see if it's an issue that you're having that may be attributing to your depression. A starting point for me with my patients, I like to check their vitamin D level, their thyroid level, their iron level. And for these reasons, vitamin D deficiency has been linked to depression. Therefore, if you're vitamin D deficient, taking a vitamin D supplement can be what's needed to help lift your mood. Hypothyroidism. Hypothyroidism is low, an underactive thyroid. So your thyroid levels are low. This can mimic depression because it can produce mood swings, sleep issues, fatigue. So it can look a lot like depression. Low iron, anemia. It can also mimic depression. Makes you feel tired, sleepy, lack of energy. So starting with these labs, getting a baseline lab result to see if they're high, if they're low, if they're normal, is a good starting point, because these are easy adjustments. You can take supplements for that to help lift your mood. Now, if the labs are fine and there's no need to make any adjustments there, some other options you have for lifting your mood without medication are spending time outdoors in the natural sunlight. Sunlight is great for improving vitamin D levels naturally. Engaging in cardiovascular exercises such as walking, dancing, bike riding, swimming, fishing, anything that's getting that heart pumping and moving, it's really good for depression. Listening to music, playing your favorite artists. Remember, there's a song that can apply to any situation you're going through. In fact, I encourage you to turn on Bill Withers' Lovely Day and just see how it makes you feel today. Eating a healthy diet. What we eat have a direct impact on our brain health. I encourage you to add protein, oats, fruit, and vegetables to your diet. Staying hydrated. Water is the best. Getting adequate sleep. So aim for 7 to 8 hours of sleep so you're well rested. Self-affirmations. The brain listens to what we tell it. So tell yourself positive things. Find yourself positive quotes, things that will uplift you and not be a negative impact on the brain. Spending time with family and friends. Socialization can help prevent isolation, which is linked to depression. Psychotherapy, talking with a licensed mental health provider. Sometimes medications can be beneficial to help lift your mood if none of the other options are working. Medications, they're safe antidepressant medications that can be used, and once you're feeling better, can be weaned off. So, if you or someone you know may be struggling with any of the symptoms I've discussed, I would encourage you to seek an evaluation from your primary care doctor or get connected with the mental health provider for depression screening and evaluation. There are many options to help improve your mood, so there's not a reason to go another day feeling down. Thank you for tuning in, and if you found this discussion insightful, I encourage you to like and subscribe to my channel. Until next time, thank you and have a great day.